Let's be honest, we've all been there. You're staring at an ECG printout, and it just looks like a massive sea of messy, completely unpredictable squiggles. You feel totally lost, right? Decoding heart rhythms can be incredibly overwhelming, especially when the clock is ticking or test day is right around the corner. But hey, don't worry. In this comprehensive, longer format explainer, we're going to take our time and make decoding two of the most common arrhythmias, atrial fibrillation and atrial flutter, effortless. We're going to strip away all the confusion and replace it with two beautifully simple visual mnemonics. Here's our roadmap for today. We'll start with chaos versus circles, move on to fish in a bowl, and then the flying loop. After that, we'll hit the ECG breakdown, look at shared risks and causes, and wrap it all up with the 10-second exam pearl. Section 1, chaos versus circles. This is the overarching paradigm shift that completely separates these two conditions. Okay, so here is the absolute foundational rule. If you take literally nothing else away from this, burn this into your brain. Fibrillation equals chaos, and flutter equals circles. It's really that simple. When we talk about atrial fibrillation, we're talking about incredibly chaotic atria. Electrical signals are just firing off wildly with absolutely zero coordination. But when we talk about flutter, we're talking about circles, specifically one single, highly organized electrical loop that just endlessly races around the atrium. Think of a race car stuck on a track. So, chaos versus circles. Let's move right into our first specific condition and see how this builds into a really powerful memory tool. Section 2, fish in a bowl. I want you to picture this. Vividly imagine a glass bowl completely packed full of frightened fish. Every single fish is darting and swimming in a totally different direction. They're bumping into each other. It's frantic. Nothing is coordinated. Well, that erratic, completely uncoordinated energy, that is exactly what is happening electrically in atrial fibrillation. Now, when we connect that frantic fish metaphor to the hard clinical facts, it all clicks right into place. Remember FIB, fish in a bowl? That bowl of darting fish translates directly to chaotic atrial activity. And because they're all swimming totally independently, there is no organized contraction of the heart muscle. None. And because there's no organized contraction, you'll see 0 P waves on the ECG. The final result of all that chaos? A completely irregular heartbeat. You know, you can even use the letters AF to reinforce this. A stands for all over the place, and F stands for fish swimming randomly. So next time you see an ECG with a really messy, squiggly baseline, I want you to immediately picture those frantic fish. All right, let's pivot to our second contender to establish a visual contrast. Section 3, the flying loop. This brilliantly illustrates the complete opposite of our chaotic fish. For atrial flutter, I want you to imagine one single bird flying in perfect, continuous circles. Every single time that bird flaps its wings, the movement looks absolutely identical. The wave just keeps going around and around the atrium. Because it's a single, highly organized electrical wave, the ECG is going to show identical waves that look exactly like the sharp teeth of a saw. So your visual anchors for flutter are the beautifully consistent flapping wings of a bird and the repeating teeth of a saw. Let's unpack the letters FL for flutter. FL equals flying loop. Unlike those many chaotic impulses of fibrillation we just talked about, flutter is driven by one electrical loop. Because that loop keeps racing around the exact same track, it creates those classic identical sawtooth waves. And since it's an organized circuit, the resulting heart rhythm is usually perfectly regular. Now that we've got our visual metaphors down, the chaotic fish and the circling bird, let's actually look at the numbers. Section 4, the ECG breakdown. When you're checking for regularity, think of AFib like rolling dice. Every single beat is going to be different. It's totally unpredictable. In clinical terms, we call this irregularly irregular. Flutter, on the other hand, is like a freight train. Every single carriage is equally spaced and completely predictable. It is a regular rhythm, highly structured, well, unless the AV block varies, of course. But generally speaking, the unpredictable dice versus the steady train. And what exactly happens to that normal, healthy P wave we're supposed to see? Well, in AF, it is just completely gone. Poof. Just remember this punchy little phrase. AF ate the P wave. The baseline is entirely replaced by those chaotic, messy fibrillation waves. So you might be wondering, how fast are those chaotic atria actually firing? The answer is incredibly fast. Atrial fibrillation is what we call fast and funny. The atria are firing at a mind-blowing rate of 350 to 600 times per minute.
Let's put that into perspective for a second. 600 beats per minute is literally the heart rate of a resting hummingbird. That's the fast part. The funny part refers to how the ventricles respond. It's completely irregular, because only a random, unpredictable selection of those chaotic signals actually makes it through to cause a heartbeat.
Flutter, though, has a very different mathematical personality. The core rule here is that Flutter loves multiples of 300. In atrial flutter, the atria beat at a very organized rate of around exactly 300 beats per minute. But obviously, your ventricles can't keep up with 300 beats per minute, right? So the AV node steps in as a sort of gatekeeper to block some of those beats from getting through. Let's look at how that gatekeeper math actually works out. Because the atrial rate is a steady 300, the resulting heart rate follows a super predictable train-like pattern based on how many beats get blocked. And honestly, it's a really good thing it does this. Otherwise, your ventricles would try to beat at 300 beats per minute, which is physically impossible and would cause immediate cardiac arrest. So if there's a 2-to-1 block, the heart rate will be exactly 150 beats per minute. A 3-to-1 block? That gives you exactly 100 beats per minute. And a 4-to-1 block brings it down to a nice, even 75 beats per minute. It's organized, it's mathematical, it is always multiples of 300. We've spent a lot of time on their differences, but let's shift our focus to what they have in common. Section 5, Shared Risks and Causes. The most critical shared risk is actually written right into their names. The F in both fibrillation and flutter stands for forms clots. Because both of these abnormal rhythms prevent the atria from contracting normally, blood just sort of stagnates and pools in the heart. And as we know, stagnant blood forms clots. Both of these conditions can throw those clots directly to the brain, causing a very high risk of stroke. It's absolutely crucial to remember that. As for what actually causes both of these conditions, you just need to remember one word: pirates. P for pulmonary disease, I for ischemic heart disease, R for rheumatic or mitral valve disease, A for alcohol, often called holiday heart, T for thyroid issues, specifically hyperthyroidism, E for elderly patients, and S for sepsis or sleep apnea. If you spot a patient with a pirate's background, you should absolutely be on high alert for both AF and flutter.
All right, we have arrived at section 6, the climax of our explainer, the 10-second exam pearl.
I want you to go ahead and take a mental screenshot of this table. It perfectly summarizes everything we've just learned right side by side. Let's recap. AF is irregularly irregular. Flutter is usually regular. AF has absolutely no P waves. Flutter replaces them with Sawtooth F waves. The mechanism of AF is many chaotic impulses. Flutter is one single reentry circuit. AF fires at 350 to 600. Flutter is pinned at about 300. They both carry a really high stroke risk. And your memory anchors, the frantic fish swimming everywhere for AF versus the perfect circles of the bird and the saw for flutter. When you are hunting for the correct answer on the USMALE or AMC exams, you need to recognize the exact textbook phrasing. If the vignette says no P waves and an irregularly irregular rhythm, boom, you immediately lock in atrial fibrillation. If they describe sawtooth flutter waves, especially if they specifically mention leads I, 3, and AVF with an atrial N of around 300 per minute, you immediately lock in atrial flutter. So I want to leave you with this final thought for your next shift or your next big study session. Fish or saw? Will you be the one to instantly spot the chaotic fish swimming in every direction, or the steady circling rhythm of the saw? Keep these two incredibly simple visual mnemonics in your mind, and the squiggles on that ECG paper will literally never be a mystery to you again. Thanks for joining me on this explainer, and hey, happy studying.